I look good. I look really good. Hey everybody, come and see how good I look. I love juice. Juicy juice, juice. Here it goes down, down into my belly. Come on, Audrey. I got bags under my eyes. You hear me? Audrey! Look at me! All right. I'm sorry. I'm sorry. Okay? I'm sorry. Are we on? We're on now? Okay? I didn't get a time. We're on? I don't believe you. We're actually on? Oh. Good evening. I'm Ron Navy, and this is what's happening in your world tonight. Reno woman clings to life at a university hospital after being viciously attacked by a raw chicken and a Cabbage Patch doll, pinned her down into an air fryer in an abandoned Arby's, where she apparently wanted to make her own sandwich years after the establishment has already been closed. Ladies and gentlemen, can I have your attention, please? I've just been handed urgent and horrifying news. And I need all of you to stop what you're doing and listen. What you're about to see is Channel 4 News exclusive. We are at Renown Regional Medical Center in the ICU, where we have one of our reporters reporting live. This doctor that they're reporting with is currently with a HUS patient in room 201, first name Ben, last name Dover, date of birth June 9th, 1969, social security number 530426141. And to you, stay classy, Reno.
Gymnasium here with Channel 4 News. Today we'll be talking about hemolytic uremic syndrome. And we're here in the hospital with a patient and a doctor to discuss the matter.
Hi, I'm Dr. Kevorkian.
So, hemolytic uremic syndrome is often called HUS because it's hard to say. It's a group of blood disorders characterized by thrombocytopenia, microangioplasties, and acute renal damage. So essentially what this is doing to the body is causing a lot of small clots. As the small clots constrict the tiny little vessels, the blood goes through, doesn't fit. It's kind of like a car crash on the freeway. They all break and they spread throughout the body. This is a very serious syndrome. And over to the doctor.
All right, I'm here with the patient, and she has obliged us with her story. So what is your name?
What is my name? A peanut butter name. I don't have a name, it's HIPAA.
Okay. She has no name. Can you tell me your symptoms?
Well, for the last couple weeks, I've had a lot of bloody diarrhea. I'm not really sure. And a fever and chills. So it's been a lot of fun.
Okay,
I
have
feel a little
you
dehydrated.
feeling dehydrated? So are you still producing urine? Are you using the restroom very frequently?
Yes, but I can't really get a whole lot down because I just don't feel good because, I feel really sick.
Okay, so we did some testing, and it does confirm that you have HUS, which
What is that?
HUS is hemolytic uremic syndrome.
What does that mean? There are a lot of big words, doctor.
There is a lot of big words. So, hi, I'm Eileen to the left, and I'm reporting live from Renown Hospital, where we have had an outbreak of hemolytic uremic syndrome, which is caused by E. coli. I'm sure you haven't heard of it before, so I will explain a few of those things for you. So there are 3 defining symptoms of HUS. which include thrombotic microangiopathies, thrombocytopenia, and acute renal damage. HUS is the leading cause of acute kidney failure in infants and children, and extrarenal involvement is not uncommon and often has a higher mortality rate due to dialysis not being effective in treatment. But with us is Dr.
I'm Dr. Jim.
Nice to meet you, Dr. Gymnasium. We have a patient here who has also allowed us to come meet her and learn more about this disease. Do you have any questions for your doctor?
Yeah, what's wrong with me?
Well, it looks like you have hemolytic uremic syndrome. How have you been feeling?
Pretty crappy the last couple weeks. Had a lot of bloody diarrhea, a lot of vomiting, kind of fever, chills. It just really didn't feel good.
Anything
Help me?
Yeah. So we ran some labs on you. Currently, you seem a little anemic and you have a lot of broken blood cells in your bloodstream. So what this...
What do you mean broken blood cells? What happened to my blood cells?
Well, they were broken
But why?
most likely in your kidneys. And what happens here is you probably ate something not good with E. coli or salmonella or some other kind of bacteria, and the toxins of the bacteria cause your cells to make clots.
Do you have any idea what you could have eaten that could have caused this?
No.
No.
I mean, I couldn't eat the last, week or two. So before that, I just had maybe some raw cookie dough. Went to Arby's with a friend.
Well,
That's
there you
about
go.
it.
Okay, that all makes sense. Any other questions?
Yeah. How am I gonna be? Am I gonna be treated? How does that work? How do I get better?
Well, let me check Wikipedia here. Since you already have signs of HUS, the disease, we're not going to use any antibiotics.
Is there a vaccine that I can get that'll just fix me?
There is no vaccine. Most likely what we'll have to do is hook you up to dialysis and give you some steroids, and you'll probably be getting some blood transfusions as well.
Why do I need all of that? That sounds like a lot. Is that actually gonna help?
It'll keep you alive.
That doesn't sound promising, doctor.
Well, it will help. The reason for those is that your kidneys are no longer functioning, and we need to remove all those broken cells from your bloodstream in order for you to live a good life.
Gotcha.
So, diagnostic testing to confirm his diagnosis included a stool culture and sensitivity. It included kidney function labs and a complete blood count. Typically, the most supportive treatment is to treat the symptoms of severe dehydration and maintaining electrolytes and water levels in the body.
So, doctor, what's my prognosis? Am I gonna make it? Is this something people normally die from?
Well, with Shigatoxin associated HUS, which is what it seems like you have
You don't sound very confident.
from your symptoms, we are going to treat you as well as we can with the things I mentioned. Acute renal failure will occur about 50% of people, but we're going to try and manage your symptoms as best we can to make sure that your kidneys don't completely shut down.
What happens if they do?
And then we'll continue with treatment.
Sounds really unfortunate.
Yeah, it's an unfortunate event.
Yeah, I really wish I didn't go to Arby's.
No, probably shouldn't have gone to Arby's.
And in case any of you out there have visited Arby's recently, we have some lifestyle changes and tips for prevention. They include limiting your protein, limiting phosphorus, sodium, and potassium because those are all hard on the kidneys. Also food safety, including washing hands before handling food and keeping your cooking and preparation of foods surface clean. Also, you want to make sure you always want to cook your meat to the proper temperature. And if you are recovering from HUS, you want to always monitor your blood pressure and follow up with your healthcare provider for treatment of your hypertension. Back to you, Ron Navy.